Ever found yourself in a mirror-gazing battle with a stubborn pimple? If so, you're not alone. Acne, that pesky skin condition we all dread, is as common as it is frustrating. It's an unwelcome guest that shows up uninvited on the skin of millions of people around the world. But did you know that acne isn't just a one-size-fits-all problem? That's right. It comes in different types, each with its own characteristics and causes. From the familiar blackheads and whiteheads to the less-known papules and pustules, acne takes many forms. And what causes these blemishes? Well, a variety of factors play a part, including hormones, bacteria, dead skin cells, and even certain medications. But don't despair. Understanding acne is the first step towards reclaiming your skin. By the end of this video, you'll understand what causes these unwanted guests and how to send them packing. Scene script: acne. It's more than just an unwelcome face guest, but what exactly causes it? This pesky problem can be triggered by a variety of factors, and it's important to note that everyone's skin is different. What might cause acne in one person might not in another. But let's delve into the most common culprits, shall we? First up is excess oil production. Our skin naturally produces oil or sebum to keep itself moisturized and healthy. But sometimes the oil glands go into overdrive, producing more sebum than necessary. This excess oil can then mix with dead skin cells to clog the pores, creating a perfect environment for acne to thrive. Next, we have clogged hair follicles. Now you might be thinking, hair follicles on my face? Yes, indeed. Our skin is covered in tiny hair follicles. Each follicle is connected to an oil gland. When these follicles get clogged with oil and dead skin cells, voila! You have the perfect recipe for a breakout. Moving on to bacteria. You see, our skin is home to billions of bacteria, most of which are harmless. But when the bacteria known as Propionibacterium acnes gets trapped in the clogged pores, it can lead to inflammation and acne. Last, but certainly not least, are hormonal changes. This is particularly true for teenagers going through puberty and women during their menstrual cycle, pregnancy, or menopause. Hormonal fluctuations can stimulate the oil glands to produce more sebum, leading to acne. But remember, these are just the main players. Other factors such as stress, certain medications, and even your diet can also contribute to acne. It's a complex issue with no one-size-fits-all cause or solution. So now we know why acne occurs. But did you know there are different types of acne? Not all acne is created equal. Let's delve into the different types. First off, we have non-inflammatory acne, which encompasses whiteheads and blackheads. Non-inflammatory acne is usually less visible and not as painful as its inflammatory counterpart. But what are whiteheads and blackheads exactly? Let's start with whiteheads. They appear as small, round bumps on the skin's surface. Whiteheads are formed when dead skin cells, oil, and dirt clog your pores. Despite their name, they're not always white. In fact, they can be skin-colored too. They're most commonly found on the face, particularly the forehead, nose, and chin, but they can really appear anywhere on the body where pores are present. Now, on to blackheads. Unlike whiteheads, blackheads are open at the surface of the skin, which gives them their characteristic black or dark appearance. They're not dirt, so don't be fooled. This dark color is actually the result of an oxidation process that occurs when the oil and dead skin cells in the pore are exposed to the air. Like whiteheads, blackheads can pop up anywhere on your body where there are pores, but they're most often spotted on the face. Understanding why these non-inflammatory acne types form is crucial to treating them effectively. Both whiteheads and blackheads are the result of clogged pores. This can be due to a variety of factors, including excessive oil production, a buildup of dead skin cells, hormonal changes, or even certain medications. To combat non-inflammatory acne, it's essential to maintain a consistent skincare routine that includes cleansing, toning, and moisturizing. Exfoliation can also be beneficial to remove dead skin cells and prevent clogs, but remember, overdoing it can irritate the skin and exacerbate acne, so moderation is key. That covers the non-inflammatory types, but hold on, there's more to this acne story. Now, on to the inflammatory acne, the ones that really make their presence known. Inflammatory acne is a bit more severe, often painful, and considerably more noticeable than non-inflammatory acne. They are usually the result of blocked pores becoming increasingly irritated or infected. There are 4 main types of inflammatory acne: papules, pustules, nodules, and cysts. Let's start with papules. These are small, red, and tender bumps that do not have a head. They may feel hard to the touch, and they're often a result of a severe inflammatory reaction to a clogged pore. Papules can appear anywhere on the body but are most commonly found on the face. Next up, we have pustules. Now these are what most people think of when they hear the word acne. Pustules are similar to papules in size and redness, but they are filled with pus, giving them a white or yellowish head. Like papules, they can pop up anywhere, but they're most common on the face. Moving on to nodules. These are larger, more painful, and located deeper in the skin than papules and pustules. Nodules are hard to the touch and can linger under the skin for weeks or even months, often leaving behind scars. They can appear on the face, chest, back, shoulders, basically anywhere you have skin. Last, but certainly not least, we have cysts. Cysts are the most severe type of acne. They're large, pus-filled lesions that are deeply embedded in the skin. Cysts are painful and often result in scarring. They're most likely to appear on the face, back, and chest. So there you have it, the 4 main types of inflammatory acne. Each type has its own characteristics and can appear in different areas. It's also important to note that a person can have more than one type of acne at the same time. Understanding the type of acne you have is crucial in knowing how to treat it. So, what can be done about these skin invaders? Well, first things first. No matter what type of acne you're dealing with, there are a few general tips that apply to all. First and foremost, proper cleansing is key. It's essential to keep your skin clean, but remember, over-cleansing can be just as harmful, stripping your skin of its natural oils. So find that sweet spot. Not too little, not too much. Next, hands off. It might be tempting to pick or pop those blemishes, but resist the urge. Doing so can lead to scarring and further infection. Instead, let your skin do its thing. It's smarter than you think. And let's not forget about the power of a healthy lifestyle. Regular exercise, a balanced diet, and plenty of sleep can do wonders for your skin. After all, your skin is a reflection of your overall health. Now, on to treatments. If you're dealing with non-inflammatory acne, those pesky blackheads and whiteheads, you might want to consider salicylic acid or retinoids. Salicylic acid works by dissolving excess oil and gently exfoliating the skin, while retinoids speed up cell turnover and prevent dead skin cells from clogging pores. Remember, everyone's skin is different, so what works for one person might not work for another. It's all about trial and error, patience, and consistency. But what about those pesky inflammatory ones? Inflammatory acne usually requires a bit more firepower. This form of acne, which includes painful red blemishes, often responds best to specific treatments. Let's delve into some of them. First up is benzoyl peroxide. It's a topical treatment that's known to kill the bacteria that can lead to inflamed red pimples. It also helps to dry out excess oil and remove dead skin cells, which can cause blockages in the pores. However, benzoyl peroxide can be drying, so it's essential to use it in moderation and pair it with a good moisturizer. Next, we have antibiotics. These can be topical or oral, and are typically used for moderate to severe inflammatory acne. Antibiotics work by reducing inflammation and bacteria on the skin. But remember, they should only be used under direct supervision of a healthcare provider due to potential side effects and antibiotic resistance. Lastly, in severe cases, a dermatologist might recommend isotretinoin. This powerful medication is typically used for severe or resistant acne that doesn't respond to other treatments. It works by reducing the size of the oil glands in the skin, decreasing oil production and inflammation. However, isotretinoin has some serious potential side effects, and its use must be closely monitored by a healthcare professional. It's not a decision to be taken lightly, and it's crucial to have a thorough discussion with your dermatologist to understand the risks and benefits. Remember, everyone's skin is different. What works for one might not work for all. Acne can be a real pain, but understanding it is the first step to defeating it. We've explored the different types, from blackheads to cystic acne, and the variety of treatment options available, from over-the-counter creams to professional dermatological procedures. Remember, everyone's skin is unique, so what works for one might not work for another. It's all about finding what works best for your skin. Now, armed with this knowledge, you're ready to tackle those unwelcome guests. Until next time, keep glowing.